Hello, I'm Dr. Omahani. I would like to share a beautiful and very insightful case. The patient came with a severe urinary tract infection and unbearable lower abdominal pain. The intensity of pain was extreme. I gave her sepia 10 mg, 3 doses, and the response was extraordinary. Within 15 minutes, the pain completely vanished. No antibiotics and no painkillers were required. Until today she remains absolutely symptom-free. The deeper layer of this case lay in the patient's psychological stress. Her mother-in-law was psychologically disturbed and would deliberately trouble only this patient. With other daughters-in-law and family members, she behaved completely normally. At home, she would intentionally urinate, create filth, and generate chaos only to harass this patient. Because of this, the patient had to watch her almost 24/7, taking her to the bathroom every 10 to 15 minutes, remaining constantly alert. The patient shared that she used to stand like a stone at the entrance of the house, continuously watching her mother-in-law. She believed that as long as she stood there, nothing wrong would happen. The moment she moved or looked away, the mother-in-law would do something that would take the patient 3 to 4 hours to manage, whether making a mess, accusing her, or demanding money. This continuous state of vigilance became her survival mode. Based on this, I selected the rubric mind, intuitive to weakness of others. Here, intuitive refers to a very strong sixth sense or gut feeling that develops after repeatedly experiencing harmful situations. The patient became hyper-alert even before her mother-in-law acted, intuitively sensing what was about to happen. However, keeping the nervous system in a constant survival and hyper-alert state is extremely damaging to the body, and this prolonged stress eventually expressed itself as severe physical illness. It is a classic example of mind-body survival pathology. The patient was not merely stressed, she was living in a constant state of psychological threat. Her nervous system was continuously on guard, functioning in survival mode. When a person is forced to stay hyper-alert for long periods, the body eventually breaks down at its weakest point. In this case, the urinary system. The patient had developed an unusually sharp intuition not as a gift, but as a consequence of repeated trauma. Through constant exposure to her mother-in-law's behavior, her mind learned to detect danger even before it appeared. She could sense the intention, weakness, or next move of the other person in advance. This heightened intuition kept her safe psychologically, but at the cost of exhausting her nervous system. In short, her intuition was not intuition of wisdom, but intuition born out of fear and repeated injury, and that chronic hypervigilance finally manifested as acute physical disease.